I come from a background of reconstructive plastic surgery and burns. Holding a scalpel was something I did every day in my former life as a surgeon. As I came into the new world of aesthetic science, I traded the scalpel and I now focus wholeheartedly on topicals, technologies, injectables, and a number of other treatments in order to address aging of the skin, aging of the face and the body, and now the scalp. When I look into my learning throughout the years, lasers has become a very, very key part of all of my treatments here at S-Thetics. When I think back about the tutors, the mentors, the people that have shaped my education through these years, I think of key people that have really been a huge influence in my new world in aesthetics. So, when I focus on my laser practice, I would like to say a big thank you to a very special person, Dr. Dianne Quibell. I have the honor today of inviting Dr. Dianne Quibell all the way from Boston, right here to Beaconsfield, virtually, to share with you some of her insights into the world of laser science. Dr. Dianne Quibell is a world-renowned cosmetic laser surgeon. She is also Assistant Clinical Professor in Medicine at Harvard Medical School. Dr. Quibell has been an inspiration to me and really sparked the interest in wanting to learn all about laser science. When I look back at the treatments that we deliver from the Icon laser and now the brand new Picosure laser, I see laser skin revitalization being a very commonplace for 2021. It already is with our patients at S-Thetics. So ladies and gentlemen, please allow me to welcome to you Dr. Dianne Quibell. But just to give you a bit of background about what all this is about, Dr. Quibell, and firstly, I just want to thank you so much for your time. I'm so excited that I'm here.
My pleasure. I'm happy to help you.
Well, you know, it's just so exciting because I'm here in the heart of Beaconsfield in Buckinghamshire in the UK, and you're over there in Boston. And, you know, I can't come and see you. You can't come to the UK yet because of all these really interesting times that's going on. But because of the virtue of telecommunication, we can do that.
Yeah, it's really cool.
It's amazing. And what I'm doing right now is we have really focused, just like how you focus on educating and you educated me without you even realizing it for the last 5 years when you're on stage talking about, you know, laser physics and laser dermatology and how these lasers have integrated into your practice. But, you know, laser physics is in your DNA. The way I say it to my audience is, this lady and this physician has wavelength running through her blood, you know. And there are very few people out there on the planet that can make that look and sound sexy. Excuse my friend.
Yeah, it can be pretty boring. So you have to do something to get it spicy.
Absolutely. And you do that. And because of that, you inspired me. So this is where I am now. So I no longer operate anymore, but I have things like this running through my blood every day.
Yeah.
But so the purpose of me opening the clinic was that I really wanted to educate our patients by virtue from myself, and by them getting educated, they can understand, you know, what these treatments are doing, how they benefit, but they're also demystifying the science, because these kind of things can be quite scary to someone who's never been in that space before. So today, what we're doing is, today is a virtual education event. We've had one every year. It's going from strength to strength, and our audience now just wants to learn. And I want to include people around me that have meant so much to me in my learning and my professional development. And I want to share the likes of amazing physicians like you with my patients.
Well, thank you. I'm happy and I'm humbled. And just so you are clear for the disclosure, I'm actually not a dermatologist. I'm an internal medicine physician, but we call myself either an aesthetic medical physician or a cosmetic laser surgeon. That's the US term.
Yes.
So you can call me whatever you want. I just wanted to be accurate for your posting.
Thank you. And, you know, thank you very much. And it's really interesting. And it's a great point that you brought up as well, because you have so much knowledge on skin, how it is anatomically as a norm, but how it behaves when it's being triggered. And you know how to manipulate skin in order to produce what patients want, a result. So with that in mind, Dr. Quibell, patients often misconstrue, and I don't understand why I'm called Miss, when I'm a doctor Miss, but we would love to hear more about you, your background, your credentials, you know, how you started in aesthetics and how you developed your passion for lasers. Do you mind sharing that with my audience?
I'm happy to share that. So we all have an interesting story, and you're not the first person to ask me about my journey. And I always was interested in helping people look their best. And it really wasn't until a recent conversation that I figured out exactly why I am so passionate about helping people look their best. What I do know as a physician is the reason I went into medicine as a whole is to really relieve suffering. I don't like people to be in pain. I don't like them to be uninformed. I really like to help educate people and relieve suffering. I was that kid who, when a bird hit the window, or if there was a dog who got injured by a car, I was the kid who went out and tried to take care of them. So I think I'm a caretaker by nature, but I also am very invested in science. But for me, I always wanted people to look their best, because I knew when you look your best, you absolutely have confidence and you're empowered to really do amazing things. And I think that's why I got into aesthetics. And the reason it's personal for me, and this came to me recently, is that I wore very thick, ugly, horrible glasses when I was in kindergarten through all of my school days. And I was very self-conscious, and people would actually steal my glasses and hide them and watch me grope around. And it was humiliating. And I know I was judged for having these horrible, we called them Coke bottle glasses. And it really affected everything about me. And then I got contact lenses when I was young. I was in 6th grade. And I said to my mother, she took a picture of me, and I said, "Mom, I'm pretty. I'm pretty." And she said, "You've always been pretty." I said, "No, I haven't. I've never been pretty. You helped me to be pretty." And so that, I think, really is a foundation for me, is understanding you can come from not feeling confident about how you look. And then in aesthetics, we really empower women and men to really look their best. And when people see you and you have that air of your own kind of beautiful, I think we all are beautiful in our own ways, both inside and out. But from an aesthetic perspective, some people have a bit of an advantage, and I wish we didn't judge each other by looks. But if you look at nature, even some animals are beautiful so they can attract their mates. So beauty is something that is universal, and it doesn't have one language, and we can all identify with it. So when I help a patient remove hair off their face, particularly a woman who feels ugly, or if I take someone who's had a disease like acne vulgaris and they've had scarring, and we improve their scars, or they've had some health issues, and so they've had stretch marks as a result of weight gain from a health issue, and we get them looking their best, it changes their whole perception of themselves. And when you can love yourself, I think you can love others. And for me, I mean, I get chills when I say that. That's the magic of the universe. I think God created us to love each other. And it's sad if some of us do not love ourselves as much as we need to. So I'm a bigger girl, and, you know, now we have size inclusivity, and, you know, we're really all about welcoming all people from all colors and all backgrounds and all sizes to really be their own kind of beautiful. And that's sort of my mission statement in coming through to aesthetics. So when a patient comes in and they're happy with the result, I really have had a great day. And the opposite is true. If a patient comes in and they said, "Oh, I thought I was going to get a bit more improvement in skin texture or the wrinkling," I'm equally disappointed. And then I become passionate about getting them to their goal. So we create a team in trying to formulate a care plan to get them to their most optimal aesthetic goal.
I love that. Thank you so much for sharing just your entire journey from childhood to teenage to beyond. You know, it's so nice to just hear it straight from the heart, really. Not many people get that opportunity to hear it from their physician because, you know, it could be a closed door type status. So I think it's really humbling that you get to share that with your patients. I think they understand it, where you're coming from. They understand that you're really in it to be part of their journey. And I'm so aligned with your vision in actually taking that patient through the journey. I love what you said about if you don't quite hit the mark with what their expectations are, you feel it too. And
oh, yes. I mean, I always say, you know, this is a pandemic and there's that saying, we're in it together. But that is my day-to-day with patients. I really want to give them the best outcome. And, you know, most of our technologies, we're creating an injury and we're counting on the body to repair that injury. And then we can support them with nutrients and various things topically and systemically in addition to our treatments. But some people just are going to respond phenomenally and others not so much. So I always let them know, like, you're an individual and you may respond better than I expected, or maybe a little less than, but regardless, we're going to figure it out. And I'm committed to them just the way they are committed to me. So it's really a team approach in achieving their goals.
You have a fantastic team over there as well. And tell me about, you mentioned about creating injury to the skin to get a benefit. So this is where our laser technologies come into play. So could you give me an idea, and our patients, how long you've been using lasers for Dr. Quibell? You know, where have they come from in your life? What were they like and how have they evolved for you?
Oh my goodness. So I'm just over 20 years in lasers. I've had lasers in my hand before we had the internet. There were no cell phones.
That's
We
brilliant.
didn't have a rotary phone.
I love that.
Dial. But lasers actually, they go way back into the 1960s and 70s.
Yes.
And I didn't start with lasers until the late 90s. And I remember the first patient that came to me, she said, Dr. Quibell, do you know anything about laser hair removal? It was 1999. I said, no, I don't know how lasers remove hair. Let me look into that for you. And in my journey of searching about how this works, I ended up buying 3 lasers, one for removing hair on all skin types and one for skin rejuvenation. And that was really where my passion for skin came in. I also have a background of being a makeup artist. I just did it part-time a little bit at the end of high school and through college. And what I did a lot of brides. And it was amazing to see women who are on hopefully one of their most special days of their life, and you put their makeup on and they just feel beautiful. And I wanted to do that for people every day, but I didn't want to always do it with makeup. I mean, I love makeup. I think it looks great, but on skin, you want to be fresh and natural on your skin. So as a rule, I don't wear facial makeup. I only wear like a little tinted sunblock so my patients can see what natural skin looks like. I think none of us really want to cover our skin. We want to be fresh. We want to be natural. And then, you know, we want eye makeup to look sparkly and pretty, but we really want to have a fresh face and we don't want to look tired. Or those of us who looked prettier when we were younger, we often don't hear that as we age. And I think it's not so much about getting older, it's about looking your best wherever you are in your life and really taking care of your skin. You only get one set of skin, but the best part about skin is it does regenerate. And so you asked me a question about the lasers. When we started with lasers, and it was back in the late 90s, these devices didn't even have cooling. We had to put ice on the skin, fire with the laser, and put ice on the skin so we wouldn't burn. And in the beginning, we could never treat darker skin tones that were brown and black because the lasers see color. And so that was a big concern. So I'm in America here and everybody's a little blended. We have all sorts of colors mixing together. And so we had some injuries in the early days. So we really were careful to really treat only the lightest of Caucasians so we wouldn't get into problems with pigmentation. So just the way digital technology has now evolved, lasers have evolved. My first cooling came out, and this was actually in around 2001. It was a laser for blood vessels, and you put the laser on the blood vessel, and if you didn't cool with the ice, you would have a blister. So we thought this was fantastic when it came out. It was like an ice popsicle that went in the freezer with a glass lens, and you'd hold the glass lens and put the laser inside of it. And we thought this was just revolutionary, because now we have cooling and lasering at the same time.
Yeah.
Just to minimize, so everybody, when I treated blood vessels, everyone would get blisters because we didn't have the technology. And now I know you have your icon, and it's got software in there, and it's got temperature feedback where the device won't even fire unless the sapphire tip is cooled to 5 degrees. So you actually have to work hard to burn someone now, where it used to be an expected outcome of lasers. So because of software, digital technology, and frankly, our understanding of skin, we really now have a whole portfolio of devices that are safe and effective. And for me, I like to think of modern beauty as beauty with energy. So it used to be you would just go get a facial or skincare, and now you come in and you have a little injection or you have a little device put on your skin. And that's becoming really the modern approach to skin health and beauty.
I love the way you said that, beauty through energy. It's brilliant. I call it, like, yes, introducing tech and using tech through beauty. But you've explained that so beautifully, how you talk about the evolution of your practice from, you know, the 90s and now 2001, when you had the devices that made things easier for you with less incidence of side effects. And what was interesting is you talk about the side effects as it being acceptable and norm in the past, but you and I both know now it is unacceptable with the knowledge that we've learned and that we've gained. But that is going to bring me through to the next point quite nicely, which is about the common misconceptions now with our existing audience, with our existing patients. What are the most commonest misconceptions? So lasers can burn. Obviously, we are inducing a controlled burn, but could you elaborate on that, Dr. Quibell?
Oh, sure. So lasers initially were meant to probably burn some things. We did have burning lasers, and that was the original resurfacing. It was CO2. It really burned off the skin. I actually had a patient who was from London who saw me, and she described her procedure as bobbing for French fries. So you could imagine putting your face in a fryolator and coming up with no skin. And that was really all we had for acne scars and for aging concerns, was this full burn. And although some lasers are thermal, now we have lasers that are either mechanical, they work by hitting a target in the skin and creating something different like vibration. So I always like to tell people, you think of lasers as sort of magical and mystical, but in fact, they're very specific and they're very, very scientific. All lasers have a target in the skin. It's either melanin or brown pigment, hemoglobin, or water. There's also a target for fat on some of these devices. So we just need to make sure the target that we're trying to sort of come in with and selectively destroy is bigger than the surrounding skin. And then we can actually use proper parameters, which is what, of course, you're an expert at now with education, for the right wavelength, the right energy, and the right essentially pulse width. I tell people that's the cooking time. That's the time that your energy is being delivered to your target in your skin. So the goal in the case of brown spots is to heat those up enough, but to not heat the normal and healthy surrounding skin. For blood vessels, we want to heat the blood vessel till it's closed and injure it enough, but not so much that we have damage to the surrounding skin. So we actually can control the zone of heating, so we can sort of selectively target something bad, and then we allow the skin to heal. So you've eliminated the bad thing, and now you have your normal skin around looking uniform and also being healthy, in fact, without scarring. And I think that's something that seems magical, right? Is that we can have an injury with no scarring because of this concept of selective targeting.
That's wonderful. Thank you so much for being so clear on that. And I think that's what our patients really need to know when we're consulting them. They need to know that, yes, we are evoking an injury into the skin, but for a benefit and for a positive outcome. And if you do it correctly with the right consultation, the right preparation of the patient as well, they are going to see a great result. So one of the big misconceptions with patients that I have here in the clinic is they're scared of lasers. It's a big chunky box on the side of the room. And when I first got my first few devices, they were nervous about having a procedure. Whereas now I get patients asking to have an icon treatment again and again because you see the results. They happen stealthily underneath. Could you explain the way in which it does that, you know, how it influences collagen and how this trigger actually can make collagen grow?
Right. So that's actually the mystery of regeneration and wound healing. So what we're doing is we're creating sort of micro wounds so small in the skin that they don't induce scarring. And we have a number in aesthetics, and you know, it's a 500 microns or less of an injury when we induce that into the skin. And that's so small. That's 0.5 millimeter, like a hair. When you induce that into the skin, you destroy tissue. And we either destroy it by like killing it and leaving it there. We call that coagulation. That's what we see with our fractional devices, like the fractional 1540. And the target for that is water in the skin. And water is in every living tissue, and it's in all parts of the skin except for the outer dead layer, that stratum corneum, that most of us are exfoliating off, much of it anyway. So we create this injury in there, and then the body comes in and the body starts what we call a remodeling response. So initially there's a little swelling, and then the body has all sorts of cells that come in. And then once those cells come in, they start to create repair mechanisms. And part of the repair mechanism is they turn on production of two proteins called collagen. One is collagen, and the other one is elastin. And these are two very important proteins in the deeper skin called the dermis. And when you lose those, you get wrinkles, you get looseness to the skin, you get lack of smoothness or textural change. And what we induce is we induce more collagen, more elastin. And so you have smoothing of the skin, you have a brightening of the skin, and you have improved tightness of the skin or firmness of the skin and less wrinkles. So the skin actually is getting younger. And it's really exciting to have skin that gets younger because those of us who are in this know this is the depressing part. At 25 to 30, we have our maximum amount of collagen and elastin, and we lose 1 to 2% every year after the age of 30. So we have to do something to this trajectory to kind of level it off and then build it up so that your skin can be looking younger. And it really is younger if you do these therapies.
It's so true. And I see it in patients now. We have a system here called the Visia Skin Imaging. And now that I'm 5.5 years in and we've been treating patients for that long, and they look younger now. The skin is behaving younger, it's lighter, brighter, tighter, it's all of those things because it's been nurtured, it's been triggered, and they're going into their 40s, 50s, 60s, and even 70s looking better than they did 5 years ago. It's great to see.
It's amazing. And I love the Visia system because what the Visia camera sees is exactly what the lasers see. They see these dark spots or red spots under the skin. They can read pores or texture. So it really helps us formulate a treatment plan so that our patients can look in the mirror and say, yes, that's exactly what I thought was happening. But we can actually diagnose and formulate a specific treatment plan based on what their concern is and what the Visia camera analysis system sees. So it's a great device, and I'm so glad you have that in your clinic. I don't know if your patients know it's a big investment. So definitely come into Miss Sherina and get your Visia analysis. It's really fun. I actually had mine done. We just got our camera system. I got lasers way before I got the Visia. We've just had it just about a year. And as soon as I put my face in, I couldn't wait to get my first treatment. And my blood vessels went from the 20th percentile up to the 60th percentile with one treatment. And my brown spots went from the 30th percentile all the way up to the 85th percentile. Just one treatment.
That is amazing. So you've got your own before and afters now.
Yes, and now I'm competing with myself. I want to get even better numbers next time.
I think that's a good thing. Is aesthetic goals. It actually gives you a buzz. You want to do more as a patient and a practitioner. I love the Vizia. I'm so excited that you've got it as well. And it's interesting because it's positive affirmation for a patient as well. They can see and track their own changes. As you said, they can get competitive in a healthy way against themselves, but it forms that ultimate baseline. And I remember 5.5 years ago, my first investment was actually the Vizia before anything else. And we have a rule here, no Vizia, no treatment, because it means that you're going in blind. So no, that's wonderful. So in your case then, you have a number of lasers with you. What do you use your lasers for and why? So for example, is it pigment? Is it vascular? What are your most commonest treatments that you do with lasers?
Yes, so I'm really into skin. I do body treatments as well, but skin is really my favorite thing to do. And I want to tell you, you actually used a word that I thought was great for the Vizia. You said it, it's a tracker. It's a skin tracker of your skin health, just the way I have my fitness tracker here in my Apple Watch.
Yeah.
And it motivates me at the end of the day. If I see I haven't hit my goal, it changes my behavior. And I think that's what we want to do with these devices, is we want to track our behavior and make proper changes so we can achieve our goals. So what was your original question? I'm sorry.
I think we've got so much to cover, and I'm just really excited listening to your practice. So really, we were talking about your lasers as well, Dr. Quibell, and you've got a number now, I'm sure. I'd love to know how many lasers you have, but don't worry.
I want to say wavelengths. I think I have over 20 wavelengths in the clinic. We also do have the laser graveyard, the ones that we don't use as much anymore. And I'll tell you my number one treatment still, and I think it's because it's so easy for people to have the treatment and see the remarkable improvement. My number one is a skin tone treatment where if you have brown spots from sun damage or broken red blood vessels from rosacea or sun damage, some people call it photofacial. We use a combination of hand pieces to get the red and brown targeted, and then the blood vessels close up and the brown spots actually get heated and they get much darker. And so they almost get like pepper, and then they lift up and they slough off through the skin. On the face, it happens quite quickly, sometimes 5 to 8 days. On the back of the hands, it can take about 2 weeks. So we can actually selectively target brown spots and really lift them through the skin. And now that was really only good for lighter skinned people. And we have many patients who are coming in who are either Asian background or Indian or even browner or blacker tone of skin. And we always had to do peelings and we couldn't use our energy devices. So about 5 years ago, I got a Pico Laser, which originally was designed for tattoo removal. But the Pico Laser, you have your Pico? So exciting. So with the focus lens. So for me, that is the close to a magical laser I have ever used, because this device doesn't work by heat. It works by vibration. So we target melanin in the skin, and even the darkest of skin tones we can actually treat because we're able to actually mobilize some of that pigment. And there's a special handpiece on the Pico Laser with the focus lens. It creates a unique injury called laser-induced optical breakdown. It's a phenomenon that occurs right in the top of the skin. And when we're putting these in, we put tens of thousands of these into the skin just over about 20 minutes. And you start to feel like you have a sunburn, but you're not getting a burn because you're just feeling warmth from this reaction. And as quickly as this comes, it goes. It lasts, the reaction, maybe 20 to 30 minutes. So by the time you've left my clinic, you don't even feel that warm anymore. And it's coming down, and there's no swelling the next day. And patients love this. this induces a nice wound healing response. So you get new collagen and new elastin, which, by the way, it does take 3 to 6 months. So I tell people you might need 3 or 4 treatments at about a month apart, but then we've got to wait 3 to 6 months till after the last treatment. That's when your body's response is complete to making that new collagen. So you have to be quite patient in the process.
That is so wonderful to hear, and you've described it beautifully. I can see why your patients just follow you and understand your laser world, because just of the way that you're able to articulate it to them, I can be quite, how would you say, yeah, maybe a little bit too scientific on the other side of things, but you've brought it so nicely. So thank you so much for sharing that with us. And I think you've named 2 of the 3 treatments that I'm currently using. So I think we spoke about the 3 for me, the blended treatment for the toning of the skin to target the reds and the browns, and also to get the collagen stimulation at the end of that. And then finally, my brand new Pico second laser as well.
I'm so happy you have the Pico. So I mentioned I have at least 20 wavelengths, and I will tell you that I can't turn them all on at the same time. But every day when I go into my clinic, my staff arrives before me, they turn on the Pico and they turn on the icon. And the icon either has the Max G or the 1540 on it. And those are my most popular treatments, and they have been for actually quite a long time. It's really the great treatment because the downtime is so low, but the benefits are so great.
From Boston to Beaconsfield, those are the 2 devices that my team fire on upstairs every single day in the autumn, the winter, and then we kind of almost turn it down when the summer comes because everyone's out and about and their melanin counts are fluctuating in a very, very beautiful way. So we tend to kind of go a little bit low on the lasers then. But yeah, this has been a huge revolution to the way in which we approach skin revitalization, because I see this becoming commonplace. It probably is for you already. I'm bringing something very new to my local community, but I see this just become photo revitalization facials almost. I don't like to use that word facial, but it's just going to become the norm.
Yes, and I agree. And I know why you call it a facial, because there's no social downtime with this treatment.
No.
So it actually doesn't feel like a procedure, where the other aggressive things that I do feel like a procedure. So you had mentioned 3 for me, where we use the Max G to target red and brown, and then follow with the 1540 to actually create that collagen injury. What I've often done now is I'll start with the Max G for red and brown, and then I'll actually come in with the Pico instead of the 1540, and it saves on that downtime. Sometimes I'll combine the Pico first and then maybe use the 1540 for some areas of scarring or along the jaw if I want to get a little bit more lifting and tightening. So the best thing about this is you can combine the devices, because patients really just want the best outcome. So I'm going to use all the tools I have in my toolbox to give them the best outcome. So sometimes during the treatment, they're wearing eye shields and I'm switching my glasses and switching my laser, so that I say, what's happening? So I'm turning on another laser and I'm switching over, I'm changing the handpiece. And so there are so many combinations that we can offer. And Ms. Sherina, just to remind the audience, you know, lasers for beauty is really new. It's new since the cell phone. These devices came out initially, the ones for hemoglobin or blood vessels, they came out initially for birthmarks, port wine stains, those big purple stains, or children that are born with blood vessel growths. And it's really just new in the last 20, 25 years that people are using energy devices and laser devices for beauty. So that's why I like the term energized beauty. I think beauty doesn't stop any longer at the skincare counter or in the salon where you're getting a facial. It's really commonplace to have a little injectable and have really the best looking skin that you can. You only get one skin, and so why not take care of it?
Absolutely spot on. It's the absolute core. It's the foundation beyond everything else. And very similar to you, I echo that to our patients. I say, we had a patient earlier with a consultation, and it was an injectable consult. about fillers and toxin, etc. But the skin wasn't right. And I said, if you think about it, if you reset the face with fillers and you neuromodulate with toxin, what about the envelope? If the envelope is not glowing and shiny and hydrated and with, you know, measured collagen remodeling, which you can see in the Visia, there's very little point in actually doing everything else when we're missing the icing on the cake.
I completely agree. And I think that's our job as clinicians, is to really educate people. Sometimes they just don't really understand how it works. I like what you called it. I actually call it the skin envelope. So it's kind of, you know, keeping everything in there so you can make muscles not move. So I always tell them injectables, you know, injectable neuromodulators. I can't frown. I haven't frowned since I think the late 80s or the early 90s. This is my neuromodulator. And then we lose volume. So that's below the skin where we're putting the volumizing agents, but you have to treat the cherry on top. You have to treat the skin and your results will be better. It won't look right if you just put a painting up and you only put half of it up, or you just fix the frame and you don't, you know, freshen up the painting on the inside. You have to treat the whole cosmetic unit, as we say. So I think you're doing a great job out there educating your people one person at a time. And I'm so glad people will be tuning in and listening to this educational event that you're putting forth.
Wonderful. Thank you so much, Dr. Quibell, for sharing that with us. And just to wrap up then, you know, we're going through a very interesting time throughout throughout the whole universe. And I was wondering if you could share, just to end on a note of positivity and gratitude, is there anything that you can share with our patients here today?
Sure. So I think, you know, we've all had our own challenges in the pandemic. Some of us have had people who are sick or we're afraid they're going to get sick. And these can be negative times. And so I feel like our job as humanity is to really be the light that we want people to be with us. Gandhi once said, be the change you want to see in the world. And I feel like as leaders, whether we're leading our patients or whether you're leading your family or whether you're working as a teacher, we have the ability to inspire and elevate people. And I found that my best way of getting through a hard time is always giving back to someone. So give back to your community or your family in some way. And I think it will really elevate you. I think we're designed to be givers and not takers. And when we become selfish and we're thinking about ourselves, we really are miserable people as humans. So go and be your best self. Go get a treatment with Miss Sherina so you can feel confident and look in the mirror, and then go and share the love that you've been given to someone else and be the light that you want to see in the world. And I always say to people, be your own kind of beautiful.
Absolutely. Thank you so much, Dr. Quibell, for, you know, just being a beacon of light coming all the way from Boston to Beaconsfield. I really
Thank you so much. Oh, and I love you folks out there in the UK and England and everywhere. I have great friends over in Wales, and I look forward to seeing you soon in person, but thanks for this opportunity, at least over the Zoom. God bless the Zoom, right?
Absolutely, Dr. Quibell. But look, thank you so much for your time. You take care of yourself.
Take care. Thank you. Bye-bye.